Sustainability is, in principle, the idea that we don't use resources that are then needed by future generations. In the NHS, that has the ability to save vast amounts of money for other services, at the same time as providing more energy efficiency and also getting our services in the right place for our service users. Sustainability is quite new to a lot of estates departments, and the guys have very much come on board, tried to understand what's required and also made suggestions themselves in terms of what we can best do to make our organisation more sustainable.
As a design team, we bring together support services and outside consultants to try and achieve the best design for our service users and achieve best value for money.
The Clover ward is a psychiatric intensive care unit that was relocated from Airedale Hospital. What is quite unique about this ward is that because we work very closely with Naomi's team, we actually introduced a lot of energy-saving technologies within the scheme, which has resulted in this ward being the first ward to be wholly lit by LED lighting, which is very, very efficient to run.
We've tried to include sustainable technology in other schemes that we've carried out. So that will include the car park lighting at Linfield Mount Hospital, where we've taken out the existing lights which typically take up a lot of energy with more renewable sources like LEDs.
Having a nomination for the Eurostar Award is really good for the team.
We're working hard to get things done in the right place, with the right skills, the first time.
Salary Dental Service meets the needs of a varied group of patients who are generally referred into the service with medically compromised conditions, and also we have outreach where the mobile dental unit goes out to visit some of the most vulnerable clients in society. The partnership with the Working Women's Service started probably about 18 months ago. We reviewed our service along with the Working Women's, and we thought it would be better to deliver when they were offering other services within their organisation for the ladies to come to. It's unique, it really is quite a unique experience for everybody. They get such support here at Working Women's. You know, they feel so close to their workers. They feel safe. It's a very safe place for them here.
These patients are very vulnerable ladies who have a very difficult day-to-day living. The mobile dental unit comes to them firstly, and if they come to their arts and crafts, then they can just pop into our unit, which is fantastic for them.
They can relax. Some of them are very nervous. Eventually they stop being nervous, they chat to us, they talk about the day-to-day things. Everything's confidential here. You know, they feel at ease and safe.
A lot of the clinical aspect of these patients is different. A lot of it is emergency care. But as these patients kept on coming back, we managed to do routine dental treatment on them.
We work to fit the needs of the ladies that are here, and you know, we all go away feeling much better for what we've done in our day's work. It really is, it's a two-way process. We get as much out of coming here as the clients do.
The administration project was really about transforming the way that we deliver administrative services to the whole of the trust, and what we wanted to do was to look at all our systems and processes, really streamline them so that they were as effective and as efficient as possible. We wanted to make sure that our administrative staff could access up-to-date technology so that they could provide a really high quality service to our clinicians, and the vision around that is really about freeing up our clinicians so they can spend more time with the patients, and that would improve patient quality, safety and experience.
So when we started the Admin Transformation Programme, we had approximately 200 staff located in 45 different sites supporting 15 clinical services. Once the Admin Transformation Programme's been implemented, we've centralised those teams into 6 administration hubs.
We spent a lot of time looking at systems and processes and process redesign in order to make them as effective and efficient as possible.
So a clinician might call the hub via the telephone or via email to admin services. Patients can ring their normal patient telephone line, and that could either be routed through to single point of access or be routed through to the hub, depending on who had the skills to answer that call at that time. They would then speak to a call handler direct, as opposed to leaving a voicemail, where the benefit of the hub is they will always speak to a person.
I think it's a great example of something that really is going to transform the way we provide administrative services to the Trust.